Friends, we've made it to the final week of October, and as many of you know, October is Breast Cancer Awareness Month. Breast cancer remains one of the most common cancers among women, according to the American Cancer Society. That is why it is crucial we continue to raise awareness and have these important conversations. And we are very happy to have Dr. Nanette Wendel with us today, representing St. Luke's Hospital, to share insights on breast health and the importance of screenings. Doctor, it's good to see you.
Thank you for having me.
I've been really amazed just in the last year or two talking with people I know who have been diagnosed with breast cancer, because it feels like the surgical advancements have come a very long way. Are you noticing that?
Absolutely, absolutely. I've been doing this for 30 plus years. I know I look youthful, but it's been a long time. In those days, no matter the size of your tumor, whether it was 5 millimeters or 5 centimeters, everyone had a mastectomy. And mastectomy with full removal of the lymph nodes, called a modified radical mastectomy. So over the years, we have kind of what we call de-escalated surgery, or doing less and less and less invasive. And now the vast majority of patients are having lumpectomies if they're candidates. Also with a small lymph node procedure. But it is markedly less deforming, it is less surgery, the recovery times are much shorter, but the most important thing is, in the vast majority of cases, the survival and the outcomes are equal. So nowadays, I'd say 85% of women are having lumpectomies rather than mastectomies, unless it's their personal choice or they're not candidates.
And before we ever get to the surgery stage, most women need to have a mammogram.
Correct.
Is there a certain age that women are now suggested to have mammograms?
Yes, we all suggest, anyone in the medical field suggests starting at the age of 40. Some patients will have to start earlier because of family history or some various factors. You will see some information out there that says that you shouldn't start until the age of 50. That is put out by the government. But every medical society, any physician will always tell you the age of 40.
And you just mentioned all the advancements when it comes to the surgery side. There are a lot of advancements when it comes to mammograms too. So once an abnormality has been noticed in the mammogram, what other imaging options are there to supplement what you find out in a mammogram? Sure,
the mammogram itself has come a long way. It used to be film, then it was what we call 2D, and now it is 3D. So that has been a huge advancement. And now, if we find an abnormality, an ultrasound is ordered, and that technology has come a very, very long way. And now we also have MRI, which has really taken us to the new level because it detects things at a much earlier time than even a mammogram might.
And then finally, as we wrap up this conversation, let's talk about patients who might be considered high risk. For women who are watching, what are some things in their background that they should be cognizant of?
Family history is always the number one. Everyone thinks that family history is the most important thing, or the misconception of it's not in my family, therefore I won't have breast cancer. But only 10 to 15% of breast cancers run in families. Other factors are children. Have you had children? The age you had your children, the age of your first period, weight, all kinds of factors are put into an algorithm, and that brings out a number. And if your risk is greater than 20%, that means that you're high risk and you would be screened differently. We'd see you every 6 months with imaging, mammogram versus MRI, and you'd be watched much more closely.
And then finally, as we do finish this conversation, not only do you help patients in the office and in the OR and with their recovery, you then meet them where they are through an organization that you work with. What is that organization?
Yes, that is called Pink Ribbon Good. It is a not-for-profit organization that I'm affiliated with. I sit on their board, and it is I think, a fantastic organization. It is huge here in St. Louis, and for anyone with breast cancer, they're eligible for free meals, not only for the patient but for their families, free rides to treatment if needed, cleaning supplies, the peer support groups. It really is a fantastic organization.
PinkRibbonGood.org.
Yes.
Thank you so much, Doctor. And for
Thank you.
more information on St. Luke's Breast Care Center, give them a call, 314-205-6491. You can also visit them online at stlukes-stl.com.